this year's EHA, in the late-breaking abstract session, we presented the first results of the Andromeda study. The Andromeda study is a phase 3 prospective randomized study in which patients with newly diagnosed AL amyloidosis were treated either with subcutaneous daratumumab, with the standard of care, which is cyclophosphamide, bortezomib, and dexamethasone, versus the standard of care alone. In this prospective randomized study, the primary endpoint was the complete hematologic response rate, a very strong predictor of overall outcome in patients with AL amyloidosis. Regarding the primary outcome of the study, there was a substantial and statistical significant, of course, highly statistical significant improvement in the overall complete hematologic response rate, which was 53% for patients who were treated with a combination of subcutaneous daratumumab with CyBorD, versus 18% for patients treated with CyBorD. This substantial improvement in the complete hematologic response rate was also associated with a significant improvement in time to major organ deterioration, time to hematologic relapse, time to needs for subsequent therapy or death. And even at 6 months, there was a substantial improvement in the rates of organ responses. And actually, both renal responses and cardiac responses at 6 months were almost doubled in patients with treated with a combination of daratumumab with CyBorD. Importantly, this great result, this substantial effect, was not associated with any significant increase in toxicity. And overall, the toxicity of the combination was acceptable, consistent with what we know so far about subcutaneous daratumumab and CyBorD.